Closed captioning of this program is made possible by the Fireman's Fund Foundation.
The U.S. Supreme Court's ruling on the Affordable Care Act means California, where reform is already underway, is on the right track.
The era of the interminable late budgets is over, and I believe that if we continue on this path, this era of unending deficits will be over.
California has an on-time budget, but it's not without some pain, including furloughs for thousands of state workers and the elimination of the Healthy Families Program. Education funding remains intact if voters approve Governor Brown's tax measure in November. State park officials have succeeded in negotiating partnerships to keep nearly all state parks open past the original July 1st deadline. But the need for a long-term funding solution remains. Coming up next. Good evening, I'm Belva Davis, and welcome to This Week in Northern California. Joining me tonight on our news panel are Paul Rogers, San Jose Mercury News environment writer, and Josh Richmond, Bay Area News Group's political writer. We start tonight's program with a look at Thursday's highly anticipated ruling by the U.S. Supreme Court upholding key provisions of the Affordable Care Act. How does the decision impact California, where reform is already underway?
We love Obamacare! The Constitution does not allow for mandates.
The ruling surprised many who had anticipated the court might strike down the individual mandate requiring most Americans to purchase health coverage. But it came as welcome news to many health care officials here in California, home to an estimated 7 million uninsured.
So you have to brush your teeth, okay?
The state has already passed legislation to guarantee coverage for children with pre-existing medical conditions and for young adults to stay on their parents' policies until the age of 26, both provisions of the federal reform. And the state has already used $40 million in federal funding to develop the Health Benefit Exchange Program, a centerpiece of the 2010 legislation. The exchange will create a new online marketplace of affordable health plans for consumers to choose from, to take effect in 2014. Some may qualify for subsidies.
In order for you to be eligible to Medi-Cal, these are some of the requirements.
While the ruling did strike down the requirement for states to expand Medicaid for low-income individuals, California has embraced the option to expand Medi-Cal, the joint state-federal program for the poor and disabled. The state could receive about $50 billion from the federal government, and about 1.5 million people are expected to be newly covered by the program. But California is about to transfer nearly 900,000 children to Medi-Cal because of the elimination of the Healthy Families Program in the state budget, adding strain to that system. And to hear more about the impact of the ruling on California, Diana Dooley, California Secretary of Health and Human Services, joins us now from Sacramento. Welcome, Secretary Dooley.
Thank you, Belva.
Your agency is responsible for implementing the health care reform. So what comes next?
Well, we have been on the path to healthcare reform for a very long time in California. We've had many starts and stops. In 2010, we began to implement the Affordable Care Act by the establishment of the Health Benefit Exchange. We've been meeting for the last year and a half since the exchange started in January of 2011. We have many pieces in place, but we have much more to do. We have been operating at full speed to this point, and now we have to find a gear even higher than that and move into warp speed to get all the work done that we must in order to have the coverage that people need in January of 2014.
So you've been operating on faith that this would work out. And so far, it looks like that things are going well for California. But could you explain the key point of debate? And that was over the mandate. What exactly is it, if it can be explained quickly? And is it all that this is all you could have possibly expected, I guess, from the courts?
Sure, it is what we hoped for, and the idea of an individual mandate coupled with the subsidies that the federal government will provide to make the insurance affordable for people is like a carrot and a stick, and it's mirrored very directly after the Romney plan in Massachusetts that has also a mandate and also a subsidy. We need to incentivize people to get the care. Most people want to have the security that comes from having health insurance, but for many middle-income families, they can't afford it. For families of 4 up to $90,000 in annual income, which is 400% of the federal poverty level, they will be eligible for subsidies through the exchange to purchase their insurance. If they choose not to purchase insurance, they will pay a penalty that the court called a tax for their choice not to buy insurance. And that will go to help underwrite the costs of their care when they need it. Many people think that they won't need care, but then they find themselves in an emergency room, and the cost of that care is then borne by everyone else who is covered by an insurance plan that they pay for themselves or that their employers provide for them.
That no free riders idea is a pretty conservative idea going back. Is there any idea, though, any estimate of how many people in California might in fact not seek coverage and thus be subject to that penalty tax? Or
it actually is quite a conservative idea, and it's one that Republicans have embraced in the past, the individual mandate. They were advocates of the individual mandate in California in 2007 when Governor Schwarzenegger proposed it. We don't have any estimates in California. We're going to do all that we can to communicate with the public in ways that will persuade them that the security that comes from having insurance is better than being one accident or illness away from bankruptcy. In Massachusetts, which is our best example, less than 2% of the people have remained uninsured. That would be a very fine goal for us in California.
Madam Secretary, I think there's a lot of folks out there who have paid very little attention to this, frankly, in the last year and a half, and they're kind of overwhelmed by the complexities, and they're just catching up. So a couple of the real quick questions that I see coming up again and again on the internet and on talk radio, things like that. First, how much is the penalty if you don't have insurance? Second, are illegal immigrants covered by this program? And finally, is it likely that many private employers are going to drop health care because the government's providing it now?
Well, the first question is the penalty ranges from about $600 to $1,000, depending on the circumstances. So the reason that we in California thought that we might be able to implement this anyway, even if the mandate was stricken, is that it's a relatively weak mandate. The cost of paying the penalty is less than it would be to buy the insurance. The combination of the subsidies and the pricing that we hope to be able to get for the insurance will make it attractive to them. The question of the illegal immigrants, they are expressly excluded. They are excluded from the Medicaid expansion, and they are excluded from the opportunity to buy on the exchange. Those who are undocumented must remain in the private unsubsidized market if they have insurance at all. And the third question, you'll have to remind me again.
Are private employers likely to drop their coverage now?
Well, there has been a significant drop in small employer coverage just because of the effect of the Great Recession. The choices that will be available, we're working very closely with the Small Business Majority in the Bay Area Council and many small representatives of small employers to work cooperatively with them. One of the advantages that the exchange will offer for their employees is the choice between plans. Most small employers, because because of the cost of insurance, have to have all of their employees in one plan. If they choose to have their insurance through the exchange, those employees will be able to have a choice of plans by purchasing on the exchange. The employers will pay a price, but that cost to the employers may be less than it would be to continue the coverage. And so I think we'll work cooperatively with the business community to make it a win-win for them and for their employees as we move forward.
What about the often said charge that cost will go up, that because of this, cost will increase?
Well, we really think that this can help us control the skyrocketing cost. Premiums increase because healthcare costs increase, and there are many provisions of the Affordable Care Act that will allow us to change the incentive structure so that people are paying for value instead of volume. In a fee-for-service system, as we have primarily, you get paid for procedures and visits and diagnostic examinations. If we can move to a value-based pricing system, which is incentivized by the Affordable Care Act, we will be able to control cost, and that will be able to control the premiums. I think that we won't go backwards. I think holding down the rate of inflation will be a significant benefit, and that is our goal, and that's what we hope to do.
Who will qualify for subsidies? What will be the criteria?
The criteria is income-based, and it is a percentage of the federal poverty calculation for up from 200% up to 400%. Actually, from 138% up to 400% of poverty, up to 138%, which is about $30,000 for a family of four. They will be eligible for the state program Medi-Cal. Above that, between 138% or between, to put it in numbers, about $30,000 a year to $92,000 a year, there will be a sliding scale of subsidies that will help pay for the insurance that people will be able to buy. And there will be a range of products that will be offered through the Health Benefit Exchange. The Benefit Exchange will be a place where our goal is to make buying insurance as easy as ordering a book on Amazon.
What's the current status of that? I mean, how this has to go live next year. Some states haven't even started it yet. I know California has been a leader in getting this going, but how much of that platform is built?
We're well on our way. We have sort of three main things we have to do. We have to have a system for people to enroll in the programs, and we have recently awarded a contract. We had a very robust bidding process. We have awarded a contract to an information technology company that will build an IT system for us, a website and web capability that will be used by county programs to enroll people both in Medi-Cal and in the insurance product. We are building call centers that will be available to route information and make what we hope to be a first-class consumer experience. And we are working with the health plans to design the products and to establish the criteria that health plans will have to meet in order to sell their product on the exchange. Our goal is to have this simple, straightforward, that people who need to buy insurance will be able to know what they're getting, what it will cost, and which doctors and hospitals will be in the network if they, for each plan that they will have the option to buy.
Secretary Dooley, we really appreciate your joining us for this explainer on something that California seems to be ahead of the curve on. Thank you so much.
You're very welcome.
Well, the next step that we have to worry about is money and budget, whether it's on health care or everything else that keeps the state going. So we know about the shift in the healthy families, you know, the 800,000 or so that will get absorbed into, hopefully, federally supported programs for them. So Josh, what else? The governor signed the budget. The Democrats are crowing that we have a budget on time.
Yeah, we have a budget. We'll see how long it lasts. this. I think the critics of this budget are saying that this is a budget that's predicated on passing the governor's tax measure this November. It's predicated on what still may be some rosy revenue estimates, some rosy, perhaps overestimates of how much money the state will get from closing down all those redevelopment authorities and seizing their assets. But what we ended up with this week is that the governor used his line item veto authority at the last minute to strike about $130 million in spending out of this $91.3 billion general fund budget. We ended up with a reserve fund of about $948 million, which is close to the billion that he wanted from the get-go. So I guess that's a mission accomplished for Governor Brown. Cuts to the poor are at the core of this budget, as they have been over the last couple of years. There were reforms to CalWorks, the state's welfare to work program, and of course the elimination of the Healthy Families program that we talked about, which is going to transfer about 880,000 children over into the Medi-Cal program. And that's really where a lot of the vitriol came this week. Republicans were quick to blame Democrats of abandoning low-income children. Even though Republicans have stood in the way of any sort of revenue adjustments to pay for that program, they felt the cuts should have been elsewhere. They also derided the governor and their Democratic peers for not addressing pension reform in this budget and certain other things. But
well, what about the home health care workers? That was a hot item that the unions were on the street over that one.
And they ended up preserving a lot of what they wanted to preserve. It's not all good news. There was those receiving Cal grants at private schools are going to see a cut in their awards. There was a loss of additional child care openings, but some of the home health care, some of that stuff did get saved from the knife at the last minute. One of the other things that people have been complaining about, though, is that buried in one of these budget bills was something to move the governor's tax initiative, which is actually a state constitutional amendment, to the top of the ballot so that it appears first among the blizzard of ballot measures that people are going to be called upon to decide this November. And in fact, there's now a lawsuit by Molly Munger and the people who are behind the other tax initiative, saying that this is not fair, that the governor got his allies in the legislature to bump his to the top.
Let's talk about the chances. I mean, there's some studies that have shown that if you have a long list of stuff to vote on, and the one at the top, if it's involving money, may be worth that position may be worth another point or two,
right.
Because as voters go down the list, they get tired of spending money and they start voting no on the lower down.
A
money.
Point or two ain't going to save this.
That was my question. This was in the mid-60s a month ago. Now it's polling at 52.
Yeah.
The Howard Jarvis people, the California Taxpayer Association people, have not even run a no campaign yet. How in the world is Jerry Brown going to pass this thing?
You know as well as I do that the general rule of thumb is if you're not starting up somewhere beyond 60 points as you're going into the final stretch before Election Day, you're probably not going to pass. And with something like this just hovering right on the margin there without a no campaign yet, it seems like it's going to be an uphill battle, especially when there's still criticism out there for not addressing public pensions, when high-speed rail is still moving forward.
That was my question. What can he do? I mean, short of a huge sweeping public pension deal?
I think the strategy is going to be to pound home the idea that all of this revenue goes to education in some way. It goes 89% to K-12 education, 11% to community colleges. And these are things that time after time people say they don't want to see cut. And if the governor and his allies can make a very compelling case that this will be a school-mageddon on the day after Election Day, then that's their best hope of getting people to pass this.
Well, the present budget does say that there would be no more cuts to higher education, at least at this point.
At this point, if that tax measure passes.
Yes.
Yeah.
So he has this wide window with an interested group of people, college students, number one. And do you think that will play a role in whether he's able to get this passed?
Absolutely. I mean, if you look at what Assembly Speaker Perez said upon the signing of this budget, he phrased it as it's eliminating the decades-old structural deficit, which is something that people like you and I like to talk about, protecting public education and ensuring California's UC and CSU students will not face another year of fee hikes. Education is at the core of all of this, because, and rightly so, since it constitutes such a tremendous segment of the state budget. I mean, you can't talk about the budget without talking about the impact on education. But, you know, to some extent, this budget says, you know, it sort of isolates education, K-12 and community college education off to the side and said, if you want to pay for this, you must pass this tax increase. And we'll see if people actually swallow that.
Right, and this is the first budget where we've had a Democratic majority in the legislature that could pass a budget, right? Because the proposition
without any revenue increases, right? They are now free to pass by a simple majority. So
but they still need the 2/3 to raise taxes.
They still need the 2/3 to raise taxes.
Well, Paul, those people who you're going to report upon, those who are crazy about our state parks, got a little bit of a break in this budget process.
They did, actually. We've been hearing all year since May of last year, when Governor Brown first announced that he was going to close 70 of the 280 state parks in California, that basically, you know, a quarter of the state park system was going to close, these beloved places which are on our tourism brochures and which people, frankly, on the right and the left, it's one of the only parts of state government that everybody loves. You know, it's hard to find anyone who gets mad at park rangers. It's like, that's part of who we are as a people, the state and the natural resources. But what happened was, as part of this budget deal, which Brown signed on Wednesday night, a couple of legislators, Joe Simitian in Palo Alto, Noreen Evans from the North Bay, they found $41 million in other pots of money, you know, water treatment money, energy pots, road pots, and put that into state parks. Governor Brown line item vetoed 75% of that out, but he kept $10 million. That $10 million combined with 40 different deals, private donations to these parks. Everybody from Rayleigh's Supermarket, which gave some money, to the Big Sur Land Trust, to, you know, the city of Colusa, all kicked in for their own local park. So what we found yesterday was that 40 of the 70 have deals to keep them open for another year. 25 of the 70 are in negotiations and probably will be saved. And 5 are what we're calling orphan parks, which don't have deals. And unless someone steps forward by later this summer, those parks could close, those other 5.
Can you specify who you want to give money to out of the 5 that are left?
Yeah, you know, the California State Parks Foundation, which is a Bay Area-based nonprofit, is helping coordinate a lot of this. The 5 parks are, let's see if I can remember them all, the Benicia State Recreation Area, Zmudowski State Beach near Watsonville, Gray Whale Cove State Beach near Montara, Providence Mountain State Recreation Area down in the desert, and the California Mining and Mineral Museum in Mariposa. You know, so bottom line, this looks pretty good compared to where we were a year ago. The trouble is, all of these deals, nearly all of them, are only 1 year. Most of the donations were to keep them open for 1 more year. So we could very well be back in this situation unless Governor Brown and the legislature find a much more supportable, sustainable, long-term funding source for the parks.
You know, if the governor had come out at the very beginning and said, I want to privatize or decentralize the funding and control of these parks, it might not have been all that palatable to people, but essentially threatening to close them and letting this happen. Was this just sort of a backdoor way of doing that? You know, was that his intention all along?
The whole thing was a political train wreck. You know, a lot of observers have said that what Brown was trying to do was find a program that the middle class loved. Because under Schwarzenegger, we kept hearing that the states broke, but the middle class was not feeling the pain. It was programs for poor people that were getting cut. And so they weren't believing that there was a problem. And if you don't believe there's a problem, you're not going to vote for more taxes. So Brown and his allies were looking for some middle class programs that the public would see. But what happened was the whole thing blew up in their face when journalists and others started saying, look, this is only $22 million out of a $15 billion deficit. You're going to lose as much money in tourism. If you have one fire in one of these parks from poachers or from trespassers or vandalism, you're never going to save even this 1/10 of 1% of the deficit that you're trying to get. It's basically an idea that won't save you any money. And then all these these saviors came forward. So he's not even going to have any gates to close. So he sort of rushed to save face at the last minute and say, well, I'm saving $10 million, so I've saved the parks. Well, you know, it's something that even during the Great Depression, no governor has ever closed a state park in California history.
Well, did we save the rangers to go with the park space?
Yes, that is a very good point. There are several hundred open jobs of people who have retired, people who have gone into other jobs that are unfilled. And the number of rangers in state parks is essentially the same as it was 25 years ago, even though the number of parks, the acreage, and the number of visitors has gone up. So they're stretched thinner and thinner and thinner. It means there are fewer of the kind of campfire programs that people enjoyed as kids, where rangers talk about, you know, redwoods and stars and all that. And it means that a lot of the park system has been building up a huge maintenance backlog. 1.2 billion we have right now in crumbling roads and you know, roofs that leak and all that. So the voters had a chance in November of 2010 with Prop 21 to raise their own registration fee for vehicles $18 a year, and that would have doubled the parks budget, would have fixed the problem forever. But they were in no mood. Remember, that was the Tea Party election. They were in no mood. They voted no, and now all the environmental groups, the people who love parks, they don't really have a clear idea on where to go next. But you know, Brown has basically, as one legislator told me, has taken the parks out of the ICU, but they're still in the hospital.
Well, that's all for tonight. Interesting night. Lots of news. Thank you both, Paul and Josh. Visit kqed.org/thisweek to see past episodes and segments, and to subscribe to our newsletter and our podcast, and to share your thoughts about the program. We will be off next week for the Independence Day holiday. I'm Belva Davis. Thank you for watching. Good night.